Hello, this is Kevin Volpp. I'm here with Tori Taniguchi at Epi Lifestyle 2026. And we are very excited because Tori has just won the inaugural Healthcare by Food, Food is Medicine Most Impactful Research Award. She has won this award for work that she's done with uncontrolled hypertension among Native Americans, reporting on methods and results of the CHEERS study. And Tori comes to us from the Center for Indigenous Peoples Research and Policy at Oklahoma State University Center for Health Sciences. So Tori, a lot of people are very interested in this paper, and the awards committee really thought very highly of it. And I'm wondering if you can tell us a bit about what the paper is about.
Sure. First, I just wanted to thank you so much for this award. It means a lot to me and my team, and I'm just happy to be here. So our Center for Indigenous Health Research and Policy out of Oklahoma State University, we work on Native American health and to reduce diet-related health disparities. Native Americans have higher rates of diabetes, hypertension, and cardiovascular disease than the general population. And so for this specific manuscript, we partnered with the Chickasaw Nation in Oklahoma. We also partnered with Washington State University for the CHEERS study, which stands for Chickasaw Healthy Eating Environments Research Study, which was funded by the National Institute of Health. And this was a randomized control trial of heart-healthy food boxes to Native American participants with uncontrolled hypertension. So this manuscript was about the CHEERS study, which was a diet intervention for individuals with uncontrolled hypertension in Chickasaw Nation communities. So they received 6 months of DASH diet-approved food boxes to help control hypertension, body mass index, and diet. While this study was cut short due to the COVID-19 pandemic, ultimately we're turning this into a pilot study. We did find that blood pressure improved as well as diet, although not significant, but it was really interesting seeing the findings and how important food environment interventions are. We actually partnered with the food bank to help distribute the food boxes to participants.
Can you tell us more about how this study came about? I can imagine it required a lot of very careful work in terms of the community organizations you were partnering with.
Yes, so we actually had an already standing relationship with the Chickasaw Nation. We partnered with them on a previous study. And so it was great that they wanted to partner with us on this specific study. The CHEERS study is actually one of 3 studies under the NCHART study out of Washington State University with the aim of improving hypertension among Native American and American Indian communities. And so we were able to partner with Chickasaw Nation, and they were able to help us with the design and process. And they also did all of the recruitment and data collection for this research study.
And can you tell us a bit more about how many people were enrolled in this study and what the intervention consisted of?
So our target recruitment goal was around 400 participants, but due to the COVID-19 pandemic, we had to cut it short. So we were able to enroll 200 participants, around 200 participants, and we are actually able still to deliver their food boxes even through the pandemic. We just had to stop recruitment early.
Well, I can imagine the support you provided was especially helpful during the pandemic. Can you tell us a bit more about what you found in terms of blood pressure impacts?
The CHEERS intervention resulted in about 2.6 millimeter in mercury reduction in systolic blood pressure among the intervention group compared to the control group.
It sounds like you encountered a lot of challenges in running this study, and a real testament to you and your team. You were able to persevere. I wonder if you can tell us a bit more about those challenges.
So again, I mentioned we had to cut recruitment short due to the COVID pandemic. And so we kind of had to pivot in the way we wrote the paper. And so we had to kind of focus on more of the feasibility of the study and whether food banks are appropriate in food-based interventions. And we found that they were able to operate through the pandemic. So although the study didn't show significant results, it trended in a good outcome for hypertension and diet quality.
Well, it also sounds like you've built a foundation for further work. And I'm wondering if there's anything you'd like to share with the audience in terms of your thoughts on where you might like to go from here.
Sure. So our center actually has ongoing funding. We have a study with Osage Nation of Oklahoma, and we are actually kind of replicating what we did with Cheers, except we're using fresh produce. And so Osage Nation has their own farm, and so we're doing a weekly food box intervention with them, and we actually just completed that. And so we will be analyzing the data to see if there were any positive outcomes for that. And the main outcomes for that one were diet quality, and we also did blood lipids, as well as BMI and food security as well.
Terrific. Well, thank you so much and congratulations.
Thank you so much.